Hello, welcome to another show of our Move It or Lose It podcast. So, again, we are doing our second part of this interview, and we're really looking forward to this spreading awareness, not just in our multiple sclerosis in the month of March, but now that we've gotten past that, really spreading awareness with some other things as well. So, today I am happy to say to my guest, thank you so much for being on. I have Tyler Campbell with me, Mike Stanford, and Dawn Morgan with me today. And I couldn't be happier to have these people on that have been so gracious in helping this white woman understand more and more about our Black community. And if it's, I love that our listeners have this opportunity. So, Mike, I want to start with you. We had a really great conversation, and I want you to kind of tell our listeners about that and spreading awareness and giving a voice to the Black community. But our conversation, I felt, was so positive. I love your outlook on all of it, but I don't want to take it from you. So go.
Okay. All right. So, hello everybody. Just want to say that for me, this has been a journey. It's been a positive journey for me. I was diagnosed with MS in 2012. Um, it was kind of tough in the beginning of accepting what I had. Because sometimes they say, it's more of it was it's not a black man's disease, pretty much. They consider it more like a white man's disease. So that didn't really bother me too much because that's their viewpoint. But but for me, I just continue to push on, continue to press on. So just to tell a little bit about my story, again, I was diagnosed in 2012. It was tough, just trying to accept that because for me, I always look at myself as kind of like invincible, or you just gotta be yourself as that way. So that's how I was doing, and so for me, it started out when I had just one day when I woke up, my face was actually kind of second to the left, and my eye was actually kind of droopy as well. So I didn't go to the doctor right away. I stayed home for a couple of days just to see what was going to happen. So I ended up going to the doctor, my primary care doctor, and he said it's probably stress. And I was like, I'm not sure if it's stress or not. So I didn't like his, I guess, his opinion.
His approach to you
Yeah,
that.
yeah. So I ended up going to someone else. I went to another doctor, and she said it's probably, you know, there's some nerves in your face that go from the top, from your forehead down to your chin. She said it's probably inflamed. That she could be inflamed. So she put me on steroids for about 7 days. She said if it doesn't go away, I want you to go see a MS specialist. So I did that because it didn't go away. So I ended up going to a specialist in Philadelphia. And at that time, he said you do have the spots are where they should be for MS, but I'm not saying that you have MS. So he told me just to pretty much hold off for now because I can't. Um, I wasn't in the area, or I wasn't in. I wasn't in a position where I could start taking shots because it
Okay.
was a big enough attack. So
But
I,
they were able to they found multiple lesions at that time. So it wasn't just like one but he still
he still said it
was,
wasn't enough for yeah. He said it still wasn't enough for me to go on shots. So he said for me to go. He said wait a couple months. We'll see what happens. So I waited a couple months, and during that time, I had another attack on my brain, and
yeah,
uh, and I kind of knew there was something that changed because it affected my legs,
yeah.
and it affected my speech too as well at that time. So when I went back to him, he saw the MRI results, and he said, "Okay, you know what? Now you can go on medication." So yeah, so he put me on a steroid and Copaxone, and I did that for a while. Um, but that was the past,
Right.
But this is now. Now, what's going on now with me? I would say since 2000, I believe it's
And by the
2000.
way, for anybody who's nervous seeing this on YouTube, Mike is parked. He has stopped driving. So he's not giving me a nervous breakdown anymore. So go ahead, Mike.
So back in 2017, I had to go off my medication because I was chasing jobs, and I had to wait for the benefits to kick in. So meanwhile, during that time, when I was off the medication, um, I can kind of, my body actually felt better without the medication. And I can attribute that to because I meditate daily
Mm,
and I have a connection with my body. So I kind of know how my body feels. So during that time, I was out, uh, I had no medication. I felt better. So actually, when I went back to the doctor, this was in Florida, because this is where I live at now in Florida. He said, "Well, it seems like whatever you're doing is working." So he's like, "I don't think you should go on it." Well, he's like, I don't think you should go on medication. I was like, "Well, I pretty much had my mind set up anyway that I wasn't going to go back on my medication anyway. After I went to go see him. So ever since then, I just try to make sure I exercise. I make sure that I eat right, and I take certain vitamins.
mm,
I'll take the fish oil. I'll take a multivitamin. I'll take a B12. I'll take a D3,
mm.
and I'll take those.
So no, you're not on a DMT or anything, correct? As of
No,
right now.
nothing.
You're just really taking the approach of like the food, movement, that kind of stuff,
Yes, exercise.
and meditating,
Yes,
calming things down.
yes. Now I do believe with meditation, I think it does play a significant part in me getting better or actually feeling my best because I believe when you meditate, you get a connection with your body so that you know how your body feels and you know what affects your body. So for me now, if if I know stress is starting to trigger some of my symptoms, I can understand that because of my
Right.
meditation or my diet, because I'm eating this food, it doesn't agree with my body, so that can affect my condition as well.
For
Um,
sure.
and also that my mindset is I accept what I have, that's fine.
Mhm.
But at the same time too, I have to move on.
Right.
Um, it's part of my life, it is what it is. I just keep going. But what I noticed about some of these MS websites and everything else is that they forget about the person
Yes.
and they focus so much on MS. And I believe that they give MS too much power.
Mhm.
You know, it is a condition, and I understand that it affects everyone differently. But at the same time, too, that this is my personal opinion is that I don't focus on the issues, or I don't read about it, and it's there, and I move on. I just go forward, and that was one of the reasons why I created a Facebook group called Life After MS
Mhm.
to help others think about, you know, what are you doing besides the MS? What are you doing?
Right.
What's your life? Do you go out? Do you go out to do you work out? Do you play basketball? Do you
Right.
swim? I don't know, but what's your life after that? Because
Mhm.
I believe there's so many people they go to the website, they're on the website, just keep checking out MS, and I think by me meditating, I understand the mind body connection, and as you continue to read the negative and you start to read those things, you'll start to live those things.
Absolutely. I couldn't agree more, Mike. And I loved what you had said because I agree. And I think all of us can relate to we do so much advocating and sometimes the MS gets here and we have to set it down for a little bit because it feels like everything is about MS and we forget that there's a whole life besides MS. And I think
Right.
we can get so caught up in that we forget to live right now. And the
Yeah.
fact that Tyler, I'm going to have you go next, but Tyler's got his beautiful baby girl with him. And we lose those moments when our mind is so flooded with what is this next symptom and what is out now? What did I miss? And do I need to be on top of this? And I agree 100% with that. And I love your approach to I'm going to go forward with the best possible attitude I can have, not allowing MS to run my entire life and rule everything, every conversation. And so thank you, Mike. I'll be back to Tyler. I want to go back to what Mike said. How does that reflect in your own walk? And talk to us about how this affects you and just
Yeah, absolutely. Can I first and foremost just say, Mike as a black man, um, you just spoke so much into my life. And I appreciate that. And I commend you for that. And
Thank you.
it's yes, my brother. And it's one of those things where you just that's why it's important for what it is that we're doing. That's why this call is so important. Because like you said, Kathy, like when I was diagnosed, it was like I was yearning to try to find somebody like Mike.
Right.
And it's not being rude. I don't think it's not being mean. It's just sometimes you just need something from somebody who looks like you.
Absolutely.
Who just needs to tell you it's gonna be okay. And that's why we're doing is so powerful. That's why it's so special, because the Facebook group and the way he's living his life, those are the things that people need to hear. And it's like you just touch one person and one person can see that Mike has MS and this is what it looks like.
Yeah.
Person of color, like this is what it can look like. Because when you hit Dr. Google, we don't see it.
No.
That was frightening for me, because it made me feel like I was anomaly, because being young and not knowing any better, I was 21 when I was diagnosed, just being young and not knowing any better, and hitting Dr. Google and not seeing somebody like Mike, or not somebody beautiful and amazing like Dawn. Like, and then you see you and you have this, then it's like, oh my gosh, okay, it's not sickle cell anemia, it's not high cholesterol, it's not cancer, it's not none of the stuff that we were cultured to know from day one. And I've got this, and nobody looks like this. It made me feel like I was already set back as to how I was supposed to attack this disease. And we all know the earlier you are diagnosed and the quicker you can get a plan together for yourself, the better it can help you. Right? For
sure.
And so for me, I'm talking about many years where I'm just in my own and feeling further isolated, when I could have been doing better to heal myself.
Exactly.
And so the perspective that Mike comes with, it's valued, it's needed, and it's to know that exists.
100%.
I just wanted to tell you, like, I commend you so much, and I can't wait for Dawn to grab the microphone, because I know she's gonna shut it down. But for me, that sitting down and knowing I'm going into a doctor's appointment and about to get diagnosed, and sitting down, and the first thing I hear from an elderly white woman to my left before they call my name to go back is, you're not supposed to be here. You're too young to be here. And I could also read between the lines of her saying in this neurologist's office for MS patients is that also
your color does not fit for this.
You've never seen me before since you've been coming here to these appointments. Like, we as people can read between the lines. We know what's behind. We have been cultured to know the lines that are coming between the lines that are spoken.
Right.
You know what I'm saying? And Mike and Don, they're shaking their head because they know what I'm talking about. I knew it wasn't just talking about and so I knew from then on out, my navigation of this disease has to be more visible. Mm-hmm. Person I saw when I Googled was Montel Williams. Ain't no the world in San Diego, California, at the age of 21, I was ever gonna meet Montel Williams so he could tell me it was gonna be okay. Right. So the backdrop of our people is what you have to understand is we're always constantly overcoming. We are constantly reinventing. We are constantly putting another twist on things, and the rest of the world will embrace those things because of the way that we live them. Have you ever caught on the way that we dress, the way that we talk? And so you automatically know that if you can pick up something, and if you can do something to try to make things better and leave them better than the way that you found them, it will make an impact on the world, and the wheels will begin to turn. Yes. Right? And so that's honestly how I came into it, is because I just didn't like that I couldn't find somebody. Yeah. And know that people are going to get diagnosed earlier. And we know that our community is behind. And we know that we have to lift as we climb. And this is the way that it gets done, is literally by speaking and by opening up and giving people access, which is hard to do. That's a hurdle to climb in and of itself. And getting to get to a place of openness, to get to a place where you can say, okay, I'm going to speak what I'm going to speak, and I'm going to tell it the way that I want to tell it. And if it's not accepted, that's okay, because I know it's going to make a difference in somebody else's life.
And Tyler, I so commend that with you and Mike and Dawn and Damien and Dr. Phillip, that we can't say, that's too pretty to say her name, is that the boldness to go out and to be kind of shut down, that this isn't a disease that I have, but continuing to, like you said, leave the world a better place, to educate, to put a Facebook group together. Tyler, the speaking you do, every time you talk, I'm like, that could preach right there. I believe in my heart that the way that you go about sharing and saying, like, I've got to do this for the people that like me, for the Black man, the young Black man that's diagnosed and goes to Dr. Google and cannot find anyone that looks like me. And yet now we've got Mike's Facebook, we've got other Facebook, we've got Tyler, you're speaking, and had such great feedback from the podcast we did. And I mean, you're everywhere. I'm like, you're all over, really putting your heart and speaking, and the voice of Black voices. And this is a disease that anyone can get. And how is it different for you? And how do we overcome and push through?
And that's imperative. I think the bigger thing, and I know Don will talk on it, I know Mike did, is okay, we have it, then what's the next step?
That's right.
Yeah.
That's the part of it that's probably the most important, getting to the point of saying I have MS, but then what's the after effect? Once Mike is upright in his car and he is driving today.
Yeah.
That body. You know what I'm saying? Like that's the other part of it that they don't get to see. I was told that between my wife and I was told obviously that it would be difficult to find somebody to love you.
Right.
Because we carry baggage. This is because the doctors, they have to have these conversations with you. It's not a flaw on the doctors. It's a reality, right? We with MS carry baggage.
Right.
Okay. All of us got baggage we bring into a relationship anyway. Ain't nobody walking around here like
No. If they are, they're lying to you.
Right. That's what I'm saying. Now we got added baggage. I got an MS bag, and then I got my whole life bag that I got somebody to try to, accept them for me. And that is hard. Like that's a tough conversation reality to have. And a lot of people keep those things hidden. But we were told I got married in 2011 to an amazing Nubian queen. I don't know how I got lucky. Ordinary guy who found an extraordinary woman. So it's possible. People need to hear that.
Yes.
We were told we wouldn't be able to have children. I've been battling erectile dysfunction issues since getting diagnosed with MS, out of the blue. And I could not find a Black man to talk to about what was taking place below the belt because it wasn't working. And then, oh, by the way, with Black men, we kind of have this divinity of masculinity that we don't really have conversations, right? And so I couldn't have an open platform to speak about those things. I have 3 children. One of them is on this call. So now people know that I'm not lying. And it's okay to have libido issues.
Exactly.
It's okay to have erectile dysfunction. I tell people I started having this stuff at 21. We all gonna get old anyway. So teach you to it. But
exactly. You got a better heads up on it. You'll be able to teach them what to do.
But it also puts the level of added weight of communication for anybody, MS or not, how you communicate with somebody you love.
Absolutely.
Women, amazing conversations. Why can't we as Black men open up and have conversations too? And those are the things that I'm constantly navigating and working, but it's not necessarily your physical stuff that gets in the way. It goes back to stuff that doesn't even have anything to do with MS. It's breaking communication barriers, which at the end of the day gets us right back to what we are talking about today and how we effectively communicate and lift voices so that they can be heard. So it really goes the same circular paradigm, if you will, as to how these things work. And that's essentially every story that people are going to hear in the different ways that they navigate them today. It's going to be powerful. And these are the things in 2007 I wish I would have heard. It would have saved me so much of a headache. Yeah. But it's still, we here now.
Yeah.
And we keep pushing.
Yeah.
So y'all definitely I'm excited to listen.
I love that. And so before I want to put a pin in, because there was something I wanted to ask you about with that, if I remember, if my cog fog doesn't get bad, but I'm like, pray. Okay. So, but I'm going to go, Dawn, I want to go ahead and ask you to participate. Go ahead and share. I know you probably have a lot of thoughts now that you've heard the guys share.
I do. I was diagnosed at 20, I think the official diagnosis came in at 25. And initially, I didn't have any type of feeling that people weren't listening to me because I was Black. I had really great physicians, and I had the ear of my medical team. So people believed me. But as I navigated through, I started to look around, and I said, well, I'm the only one. You know, I'm in my 20s, still wearing heels, still wanting to go out, happy hour, living in Washington, D.C., having fun. There's nobody that looks like me. You know, so I would go to these support groups that the doctors would say, oh, you should go here, this will help you. And everybody was white. Most of them were white women, you know,
Right.
older white women. Some were very wealthy, most. So they had medical treatments that I couldn't necessarily afford, or holistic treatments. I was like, well, I want to start doing this. So I just kind of dove into the holistic world, and I was like, I don't care how much money it costs. I'm going to do the same thing because I want to look like them. I don't want to be, you know, the victim Black girl. You know, everybody feels sorry for me. And so for many years, I kind of went into denial and not seeing representation, not seeing, I know that's like the new buzzword, but not seeing women or men who look like me. And I remember being in the infusion center, seeing one Black man. I was like, oh my gosh, what's your name? Like, where are you from? You know, what's going on? And so there's a difference, because even though the disease affects us all differently, there is kind of like this unspoken, I don't know, there's this unspoken feeling between Black MSers that we kind of understand, you know what I mean? Because we all go through the different ups and downs. Again,
Dawn, tell this white woman, even though I know we chat often, tell this white woman who has ears to hear, and we're praying that others will too. How does it affect, do you believe, physically, not even the emotional part? Because I do believe it affects Black people different than it affects white people, the MS. And so how do you go past that when you know it is and no one's listening?
How do you go past knowing that no one's listening and just kind of pushing through that?
Yeah, because you really have to advocate in a much bigger way than I would have to.
Well, number one, just educating yourself. I think that's the most important, and knowing the vocabulary of this disease, and knowing the vocabulary of your neurologists and your physical therapists, and just kind of being able to open yourself up to their world so that they can open up to you. Because quite often when you go into these offices, they look at you like you don't know what you're talking about. Or
Right.
if you talk to other patients, sometimes people think, oh, well, you don't know what you're talking about. You know,
Right.
This is a white woman's disease, so you can't possibly know what's happening. It's like, well, no, this is really happening to me too. And sharing your experiences, I think that's also like educating yourself and sharing your experience so that we can come to some sort of commonality. And not knowing that you're not alone. I think what got me out of my denial for so many years, and like Mike, he hasn't taken any therapy for a while, but I went disease modifying drug free for like 9 years. I started with Avonex, and I went on Copaxone and Tisabri and then Lemtrada. So in between there for 9 years, I was like, no, I'm doing yoga, I'm doing meditation, which I still do. I'm diving in my holistic world. And one day I was watching Stuart Scott. So if you're a football or basketball sports fan, then you know Stuart Scott. And he died of, I don't know, brain cancer or something. It was some cancer he had. And he was giving a speech, and in his speech, he said, you know, every day I fight. And so there was a t-shirt that he made that said, every day I fight. I'm like, that's me. This is MS. Every day I fight. And that helped me kind of push forward in this MS world. And knowing that, yes, every day it's a fight, but I'm not fighting myself. I'm not fighting the white women who share this disease. I'm not fighting Black men. I'm not fighting anybody in this MS world. I'm only fighting MS, and it's not going to beat me. Never has. I mean, I've gotten knocked down many, many times, and that helps me move forward also, just like knowing that mantra is there and seeing others and listening to your story, listening to Mike's story and to Tyler's story. It's helpful. And then I started a podcast, and
That's what I was gonna, Dawn, hold 1 second.
Sure.
Mike, because I know Mike has to go early. He's already making me nervous. He's driving again. Mike, what is the Facebook group? So I want to put it on the bottom of the show notes, just so that the Facebook group that you started.
It's called Life After MS. And it's it's very hard to get people to sign up or even to recognize it, because I mean, I don't know what it is. It's something that's positive. And
Yeah.
And it's a group for people just to get together. I mean, just to talk about other things besides MS. So, but that's the name of it, called Life After MS.
Yeah. No, thank you, Mike. And I think it's good. And sometimes people are so attracted to the negative.
Yeah.
And so I think, I mean, I encourage you, and I'll do my best to promote it on my end. And I know we all will, but it's so crucial. And like Tyler said, how huge of a difference that would have made had that been available, something for him to see back then. And so I, again, so appreciate you doing it, especially when you're not receiving the feedback that we want when we're putting something out, right? You've heard this, it's made a difference. And it's like, come on, this is positive. Like, come into the Facebook group. So I just, I appreciate you, Mike, so much. And I love your heart. And I love that you're doing this. And anytime you need us to like fist bump you or tell you like, awesome job, just connect with us and let us be those people to like give you that high five and let you know that what you're doing is so important, and it's not for nothing.
Thank
So
you.
yeah. So Dawn, go ahead and
Thanks.
go. Mike, obviously, yeah, very much appreciated. Now with Dawn, you went a different direction. You started a podcast. So tell us about that and how that was for you to kind of get your voice out and get heard and kind of spread awareness.
Well, when I was taking Limtrada, I realized that, this is really important to talk about. And, this disease is trying to take over my life, and I don't want it to. And I want to get my voice out there. I want to share with others that, yeah, you can go through something so traumatizing and devastating as this MS diagnosis, but you can also live a full life and have a wonderful quality of life. So I wanted to share that experience. And I met a young lady that pretty much we shared the same values and ideas about speaking. And so we started a podcast called Myelin and Melanin. And it lasted for a few years, and it just recently ended. Well, our collaboration ended. And I started my own podcast solo. And being able to...
And it's called The Sound Mind.
The Unquiet Mind.
Unquiet Mind.
Yes.
I'm renaming your podcast. I'm sorry.
Okay.
The Unquiet Mind, which I love that. I love the name of, because to me, it's like the getting rid of the clutter, in our mind. It's always there. So I think it's...
Yeah, for
But
sure.
so the uncluttered mind, don't do what I'm putting down. All right. So go ahead. And so what I think is so bold of you, and I don't know, Tyler, if you know this, but after that one came to an end, she started her own. She was like, no, I'm a badass. I can do this. And I love Dawn's spirit and her drive to like, no, I know I'm supposed to do this. I know I'm called to be speaking about this and spread awareness. So this isn't going to pull me down. So just bragging on you.
I've been following it so much, and I want this. Dawn, I know you're gonna keep going. I want this because this is important, and I know a lot of people don't know this. And so having two girls, right? And so what I also had to learn, and Kat, I want you to ask Dawn to touch on this after she continues to roll through. Also understand as a Black woman, the experiences at the doctor's office and being misdiagnosed and having treatment or having their words fall on deaf ears even more so than men. As Black women with this disease, the road is even tougher in terms of visibility. And hear what it is that I'm telling you. And Kat, I'm gonna correct you because you say you're hearing. You're not hearing, you're listening.
Thank you.
People hear and they don't listen. And I hope that you asked Dawn about that experience too, because Black women have it that much harder because of their viewpoints within the world that we live in. So therefore their diagnosis, their experience within the doctor's office is different.
Mm-hmm.
It is different, which is why what she's doing is so incredibly powerful. But I'm gonna stop. But I'll just tell you that because you gotta ask her about that.
Yeah, no, Tyler, that's very good. So I'm just gonna ask it now. So Dawn, talk to Black women, all ages, are newly diagnosed, to women that have gone through this for so many years and our little ones that we get nervous about. My son was diagnosed, my daughter was not. But for you to be able to spread that out, explain what it's like as a Black woman to go to the neurologist. And for a lot of times, which I've heard more and more, just being told that it's either irrelevant, it's not what they think it is, or just ignoring. Talk to us about that.
When I first noticed my symptoms, I went to the emergency room and, I kept saying something's off, something's different. And the doctor on call, or I don't know, attending doctor at the time, he said, "Oh, I think you have the flu, so go home." And I said, "No, this is bigger than the flu." But I kept pushing, and I was aggressive. And if you aren't aggressive, I think people don't listen to you. I think that you have to build that confidence in young girls and in the newly diagnosed, that this is your body. Nobody can tell you how you feel. They may not see it because this is an invisible illness, but you're feeling it, and what you're feeling is valid. And what I had to learn going through this process was to let people hear me, like really say, and this is why I say educate yourself, because if you don't go in with some sort of knowledge, just something that where they can be able to bridge that gap with and help you understand what's going on, and you help them understand what's going on with you're going to have a disconnect. You're going to continue to have that. And the stigma of us being angry Black women, going in, that's so frustrating too. And a lot of women will go in like, "No, you need to give me this medication because I'm feeling this way, and I'm telling you this is what's wrong." And angry. And I'm not saying don't be angry, because I'm angry all the time about this.
Well, it's got to be so incredibly frustrating to go in again and again and try to express and be looked at either not seen, like Tyler's talking about, just not even like you're invisible, or to be told that this is ridiculous and it's not, this isn't, you're not correct in this.
And Tyler may be able to speak on this too. There's a difference between angry Black person or man or woman and confident.
Yeah.
And aggressive. There's a difference between anger and aggression, confidence and aggression.
And would you even use the word assertive?
Assertive.
Like
absolutely.
being assertive, and then that being confused with being angry and aggressive. Like you're being assertive and standing for yourself.
Right. And maybe I'm using aggression in the wrong context here, but I'm aggressive in making sure that what I mean by that is making sure that I have a better quality of life, because right now I can't feel my feet, or right now I'm stumbling and I'm falling and I can't, walk my son across the street, to school. So I need to be active in getting the steroid treatment, or getting you to even take an MRI, get another MRI, so that we know what's going on. And I think that's what I mean about aggression, not necessarily like attacking.
Right. No, I just wanted it to be clear so they understood, because I knew what you meant, but.
Right. But assertive is like probably the better word for sure. And just, so that you're not misunderstood. I think we we have to explain even more, you know, we have to take more time. And it's unfortunate. I don't know why, because we're not believed. We're not believed.
And Dawn, how does that feel in the 15-minute window you get to see your doctor? How do you explain it and then re-explain it for you in a way that they hear you? How frustrating is that?
That's so hard for me to answer because, like I said, I've been blessed with amazing doctors, and my neurologist is a Black woman. So, and she's top of the line. Well, she's biracial, but she's Black. She says she's Black.
Right.
But I've never had that experience where I've been rushed or not believed. But other people that I know have.
I was going to say, with your podcast, with so many Black girls and stuff, what would you say to them?
Self-advocacy. That's the main point. I think you have to be able to speak up. I have an example. I needed to get a medication, nothing major, but my insurance said, "Oh, we're not going to pay for it." And I'm like, "You've been paying for it for a year. What's going on?" No, it went under the rug. Nobody paid attention to me. The pharmacist like shooed me away, like, "Oh, you just have to deal with it." I was so frustrated because people don't see it as something that's a necessity. But if you don't stand up for yourself, if you don't speak up, if you don't make phone calls, if you don't stay on top of things, then a lot of what you're going through will be even more challenging,
Yeah.
I would say.
Oh, I could see that. So
Yeah.
I love that Dawn, that you put that voice out there, that you are that voice, that you, with the podcast, that young African-American girls, women, Black women can come and listen and see you and what you've gone through and give hope to what can be a beautiful Black face, but then saying this isn't life over, but you need to be educated on what you have. When you go to the doctors, you need to have that.
And I think it's important to get doctors to really hear us and listen to us, because the Black experience is so different.
Yeah.
We have these expectations put on us that we have to wear this resilience cape. We have to sit here and take it. And if you don't, then there's something wrong with you.
Right.
Some days I don't want to take it. I want to just come in and complain about what's happening to me. I want to be sad today. And it's okay. I don't want to wear the cape. I want to talk about how MS has affected my life. And it's okay.
Yeah, absolutely. Do you feel the freedom to do that?
Now I do. Before I didn't. But now I do. I think with more people talking and all of us coming together and being able to really listen to one another and share our experiences and to be vulnerable, now I feel that it's my reality.
Yeah.
Where it really wasn't.
I know when Dr. Taylor was on, see, I can say her last name. I can say Dr. Taylor. When she was on the last time, she talked about that as well. And then also talked about, she really was the one to diagnose herself, because she had so many misdiagnosed that they kept telling her it was this, it was that. And so finally she just kind of like did it by evaluate, like, it's not this, I know. And then she came to, this is multiple sclerosis. But years after, and the thought of, Mike going years without the proper medication, so many of our Black people going without the proper medication because it's still not believed. It's like Tyler said, being heard, but not listened. No one's listening. So Tyler, what would you say, if you can speak now? I know you've got your little one not feeling well. What would you say to that with the medication and in the Black community in general, not being heard, and the difference between being assertive for what you need to be and getting a look like that's a bit aggressive?
And I think it's important to note also, I want to say this because I come from the same place Dawn comes from. I come from that same space. Like, I do feel like there are more good people in the world than there are bad. I feel like there are, I've been through 2 neurologists, and the 2 neurologists were really doing their due diligence to hear me out and try to help me. My advice, first and foremost, to those in the medical field is, my second neurologist, when he said, Tyler, what do you want out of this experience? It was something I had never heard out of all the pediatricians, out of the neurologists, all the doctor experiences I had ever had in my life. I had never had somebody to say, what are you looking to get out of this?
Right.
What is it that you need? I've always had people come and open the door and say, this is what you got to do. It's got to be like this. This is what we're going to do. This. And I never even opened my mouth, but you already had the plan.
Yeah.
And last time I checked, my MS is not anybody else. My MS isn't Don's MS.
Right.
My MS isn't Mike's MS. My MS is different for every single person. And so when I had a neurologist who was literally like, what are you trying to get out of that? I felt like I had power.
Yes.
I felt like I had a say-so. I felt like you met me where I was. And so that is the advice that I would first and foremost give to anybody, because a lot of times that topic isn't even discussed. How do you handle a person of color?
Right.
Do you understand what we've been through, why we respond the way, why Dawn is saying what she's saying right now? There's stigma to that. And so you have to know and understand that, and know we don't come from a place of anger, but also understand that Dawn comes from a stipulation where that word anger comes from how people see, quote unquote, Black women sometimes. And it's not that a Black woman is telling you those things, it's because you're not listening.
Yes.
And so then when we do have to advocate, when we do have to forcefully utilize words, or we do have to, we have to go about things, this scenario, you don't like it, but you deem it as us being angry. That's not the case.
Right.
We're just forcefully having to explain. And sometimes that can be very frustrating because this isn't our first experience with it.
No. And so, exhausting, and doesn't help the disease.
And she's already battling MS.
Right.
And she's already battling insurance. And we're having to go from spinal tap to, all the other things that all MS people go through. But on top of having that to have to navigate, that can sometimes deem it and make it that much more tough. But I come from the standpoint like Dawn, where I was fortunate enough or blessed enough to have 2 neurologists that gave me a platform to listen and to speak. And so I just want to let people know that there are individuals out there, and that experience is possible. Because I think there are different facets of stories, and I don't want to make up my own, but that was my experience with getting diagnosed, in terms of I was lucky enough to have 2 people that way. Now, Kat, you got to tell me the second part of the question, because my mind already went blank. So tell me, because this is,
I know,
this is
I
real.
don't
This
remember
is
now.
This is how it really looks. So
yeah. So
what was
this
the second
is
part of the question,
MS.
so I can answer it.
This is like all I did, Tyler's put a pin in it. And I was like, what was the question? So I'm hoping that it comes back. I keep thinking, like, what was it?
Okay.
I know it had to do something with the girls, your daughter, and
Yes.
to do with, as far as like raising our kids. Okay. So we've got our kids, and I'm not Black. I had my own fears about my kids getting it. Didn't ever think my son would get it. What was the chance? What was it's so much less for a mother to pass it to a son, but he was the one that got it. So for you, as a Black man and woman, how do you educate your kids so that they have a voice, so that one of the things Damien said to me, it was learning to respond rather than react. So as you teach your kids in this way to be assertive without coming across as the angry Black woman, which I feel like I get so angry with the stuff in my own MS, issues that aren't being addressed. I cannot fathom what it's like for you. So help us understand the goal, what you're trying to do, what the hope is for your own kids, Tyler, for your girls.
Yeah, it's for me. I want them to be as educated as possible, as I possibly can. And so, for me, it's already, I've got I got an 8-year-old son, I've got a 4-year-old little girl, and I've got a 1-year-old. And
The
so
1-year-old is, you've got 2 girls and 1 boy, right?
1 boy.
Yeah.
And so it's been about educating them from day one. But I think the discussions are also the discussions about how they approach healthcare in general,
Right.
and to not have to shun or feel like they have to hide who they are as beautiful and amazing young children in this world, and to give them the same sayings as my grandmother gave me: a closed mouth will not get fed. And so please don't hide behind your boldness. Please don't hide or shun yourself. In fact, those are the same things that you stand on. And I
Right.
know by the way that I live and carry my MS, the one thing that we've always had as people is hope. And you've heard me say it, Kat. I try to display hope into them. If something does come their direction, we talk about it. Like,
Yes.
Daddy, can I get MS? It's
Mhm.
possible. But you know what? If you get MS based off the way you see Daddy and how Daddy is living his life, how Daddy is trying to advocate, how Daddy is trying to build relationships, how Daddy is out here speaking, if MS comes your direction, you will be much better off than Daddy was, because we've already got something for you to stand on.
Yes.
We
I love that.
have. And so I don't lie. We have open conversations. I still, when I come from the infusion clinic, I keep my bandages on so we can talk about Daddy's medicine day.
Yep.
You know what I'm saying?
Tyler, I love that, because
so we
I
can talk
didn't do
about
that.
it.
I
Yeah,
hid it.
I don't want to hide. And the reason I think we don't really hide in our community in general is
Right.
because we know for the second our babies leave our doors, we know their experience in the world is
Yeah.
totally different. So within our households, there are probably a lot more conversations about that type of stuff that we're accustomed to having anyway.
Right.
So I think the MS part of it is don't hide, couple that
Mhm.
into whatever discussions you are already having, because our babies do naturally have to grow up a little bit faster. And we have to have conversations about police. We have to have conversations about how you approach it. I mean, those are
Exactly.
already lumped in. So don't allow MS to not be a part of the same fold.
Right.
But at the same time, yes, my wife and I have had to have those conversations. And as a woman, I can't explain, as a woman being able to carry a child and knowing your whole pregnancy experience is totally different having MS. And so
Right.
it's the possibility. It is the hope that we continue to stand on as people, is the same hope that we talk to our babies about with this disease. Because I told you, Kat, hope builds determination.
Yes.
Determination leads to a positive attitude. And with a positive attitude with multiple sclerosis, there is no limit to your altitude.
Amen.
As a human being. And I told my son and my kids, if you by chance catch this disease, you may do something that has never been foreseen with this disease for our people and for the overall world. So I'm not going to discredit it. If you get it, we're going to use it. And you're going to help make this world better. And so it's about speaking life.
Tyler, I can't imagine being at your dinner table. You are the most inspirational person I've ever come across.
Oh, honey,
So
you ain't never met my wife. Oh, you've never met my wife.
No, I want to meet her.
My wife talks circles around me, honey. She's a social
man.
worker. She'll
I
talk
can't
circles around
imagine.
me.
But the way you approach it, I think, is so beautiful. I just want to be at your dinner table. I would just be like, yeah, tell me more, talk more. It was just, I can't. I'm looking forward to meeting your wife. I just, I love your heart.
We're just passionate people. That's why,
Yeah.
like Don, like we can all relate culturally. We can relate.
Yes.
Can I plug one of our fellow MSers, her book?
Yes.
Julie Stam. She wrote a book.
Yeah.
It's on Amazon and I got it. And it's called Some Days. And she has a young son and it's explaining her multiple sclerosis to her son. So I would love for people to go out and purchase her book. And Tyler, if you haven't had a chance to check that out, that would be great to show your children.
I've had her on.
I
Tyler.
will,
I'll tell you the
Thank
episode.
You for that.
Tyler, I'll give you the episode that I had her on where she's always on our once a month. We call it Wine Down Wednesdays. So we do a little bit of wine and we talk about all things MS. And my biggest heart in this is to do cross cultural and really trying to get women we've got Dr. Taylor and Dawn. I love you being on there. So it's not, so again, they're not looking at Wind Down Wednesdays about MS and all they see are all these white women. I do not want that. That is not my heart. I don't want that. And I think it's so important because you offer a light, Dawn, that I can't. You offer perspective that I cannot. And so it's so crucial and so important that happens and that we continue to spread awareness. And like Tyler, like you said, educating our kids on the power they have, like that your neurologist said to you, what do you want from this? But to tell our kids that, this may happen. However, there's been people we've got a plan. And when there's people that have gone before you, and now we may not have it the way it should be, but we've got a platform. We will tackle this together.
And not to cut you off, I'm sorry.
Go.
After a conversation with another MSer on the podcast about 2 years ago, we were talking about when you're first diagnosed, what happens. And quite often you go into a state, well, some people, I know I did, go into a state of shock. And for me, it was shock and then pause and denial. And she taught me, and I carry this with me, just like I carry the everyday I fight mantra from Stuart Scott, to be proactive instead of reactive.
Yeah.
And that has helped me along this 22-year journey of being proactive and making sure that I'm explaining what's happening in detail to my son. I have an 11-year-old, and I think it's important for him to know mom has MS and this is what it looks like. And
yes,
unfortunately, some days are not so great and some days are better. Some days I can take you to practice. Some days I can't. Some days we're gonna have takeout, and other times I'm gonna cook a full 5-course meal for you.
or you might be in the middle of the 5-course meal and it all falls to crap and you're like, pizza, because it's not working.
Absolutely. And I don't know if you guys know, it's like I'm really, really tired today. So that's probably why I'm not like all glamorized or whatever.
Oh yeah, you don't look beautiful at all, Dawn. You're not gorgeous. You just wake up gorgeous.
Well, thank you. But my energy is just a little low because I'm tired, but MS day. But yeah, that's something that I've taught him. And I think he can carry that in life. When you have a situation come to you that is a complete pivot, an alter of the path that you think you're going down, don't react. Let's just take a pause and take a look at it, and let's see what steps we can take to move forward and plan and help the situation, yourself and your disease and just all of that. So that's just something that I've learned, something small nugget.
I love that. Thank you for that.
Sure.
Tyler, I have another question too, and I asked this with the other group, and I want to make sure I say this right. When I say this, how does your faith play a part? I don't mean that you go to the doctor's office and they're, a jerk to you. They're not listening. They're maybe hearing, but they definitely are not listening. I don't mean our faith plays a part in like, oh, woe is me. Like, okay, well, they didn't listen. So I'm just going to pray that God would give me gentleness and kindness and the fruit of the Spirit. And I'm just going to move forward and not be assertive. I don't mean it that way. I mean, moving forward and getting through this. How do you feel that your faith, for both of you, a question for both of you, has helped you move forward without losing hope? Who wants to go first on this? Tyler?
Yeah, I think for me, my faith is kind of everything. And the reason I wrote my book, honestly, is because, you get into a mode where, you start public speaking, and because you have to respect the guidelines of organizations and the rules of employee workplace, a lot of times what always hurts me as a speaker is I can't tell the story.
Right.
You only want the sunshiny stuff. You only want the pretty stuff. You want the overcoming story. But when I tell you where I get my strength from, or my upbringing, or what I resort to when all 4 corners of the rooms of life come crashing down with MS, I don't get to tell you that. And I always tell people it puts a facade over what the disease really and truly looks like, because my strength comes from elsewhere.
Yeah.
Because, and it does because of how much the disease derails you. You have to call on something else that is bigger than you.
Amen.
And so it makes it look like you are Superman, or you are this incredible Hulk for the way that you handle your disease. No, but that's the part of my life that you don't really want to hear. So it kind of makes it look like I'm doing this by myself. I'm not doing this by myself.
Yeah.
And so that my faith walk and my faith talk, the strength for me started happening when I was 16 years old and I gave my life to the man up above.
Yeah.
And
I love that.
and through the trials and the tribulations. And I tell people all the time, the way that I approach MS is because of what life had started to deal me, years prior to turning 21 and getting diagnosed.
Right.
I was a kid who I went through the alternative education system. I lost football scholarships. I hurt people that were very close to me, and I had to do a lot of apologizing, a lot of reality facing, and things of that nature. Those were the things that helped prepare me mentally. And then the spiritual piece for when MS came knocking, and where a strength came from. I looked back over my life. And I think that's an important thing, is you look back over your life and you look at all the things that you have overcome, and you start to say confidently to yourself, well, if I've been through that,
right,
then I surely can get through this and also try to help somebody who's going through this as well.
Amen.
But again, that's not always what I get to share.
Well,
And
Tyler, you can share it here anytime you want to. Anytime.
So that's my faith. Why I just tell you short and sweet, and I'll let Dawn take it. It's everything to me. It is when football was taken away from me, I can't explain it, and I don't know how it happened. I looked to the neurologist and I told him, when one door closes, another one is going to open for me.
Amen.
And so he couldn't understand it. He dropped the clipboard. I didn't even know if those words came from my mouth. I just had a witness in the room, and her name was Mary, and she was like, Tyler, do you realize what you just said? And so I've been kept. I've been kept through my MS. And so for that, it puts passion behind my level of service. For myself, for my people.
And that oozes out of you, Tyler. I mean, it does. And I'll put on the bottom too. It was literally a 3-part interview we did, Tyler and I did. And for those that did not get to hear or see that, I'm going to put that in the bottom of the show notes so they can refer back to your whole story, Tyler. I love the way I want people to be able to hear from the beginning, just how you've handled it and what you're doing now. And the name of your book, just in case, what is the name of your book?
Yes, ma'am. It's called The Ball Came Out, Life from the Other Side of the Field. The Ball Came Out, Life from the Other Side of the Field. But I just, that the space. The other thing I love about Damien is he always talks about space and grace. And so I hope that more people will make room for a space to discuss spiritually. And I'm so glad you're doing that, Kat.
Yeah. Well, thank you. And that was a big part of doing this podcast, is I thought, I'm not hiding. This is a huge part of who I am. And if it offends other people, then they don't have to listen to this podcast.
That's right.
And because it's what I feel is a crucial part of my life and many of those I talk to. And it doesn't mean that you have to be in agreement with me. Obviously, not all my guests are. And nor would I ever make it a point of contention obviously, but to say that this isn't going to be a part of what I spread, Tyler, that would be cutting me in half, because without Christ and without my faith, I'm not whole, and I couldn't do the things I can do now.
I know that's right. Honey. Say it.
I say I'm ready to preach now. All right, Don, how would you answer that?
My grandmother used to say, when I was diagnosed, everybody had a hard time because no one had ever been sick in our family. And she said like 4 simple words, count it all joy. And I was just like, what? No, I'm not counting anything joyous right now. I'm like sad and I'm mad and no. But after
You're like, forget that.
Right. Absolutely. And I come from a really strong religious family on both sides. And after she passed, those words meant everything to me, because I think when you lose yourself in this disease, like the old self, and you come into a new self,
right,
you start to reflect on the things that people say and have said. And that was important to me. And when she said, count it all joy, I said, what does that really mean? And what it meant for me was where I am now. What am I doing? How am I helping? How am I making an impact in this MS, arena and
right,
outside of that as well? And so I'm counting it all joy because it's a blessing that I get to talk to you. It's a blessing that I get to talk to Tyler and Damien and Mike and Julie and all these other wonderful people that I probably never would have met. And so I also think that being able to reflect on, and this might sound so crazy, the joyous aspect of MS.
no, I 100%. Go ahead.
It helps me have a stronger connection with God and what my purpose is and what he has laid out for me in this life. And so by counting all of these steps joyous, I'm able to have a stronger connection, and that helps me get up every day, even when I don't want to, like this morning.
You're like, I'm
Okay.
tired.
No.
How important is this pod? But I find it ironic that a podcast that could be so important was one of the hardest podcasts I got together to, the different people. Usually it goes so smoothly. And this was the most difficult one to coordinate. And I thought, you know what? I know, no way, enemy, you're not winning this one. I'm going to push through and I'm going to continue to do what I felt God had laid on my heart. And so thank you guys so much for being a part of what I hope to be something that we revisit again. And as long as we have ears to listen, Tyler, right? Not hear, but to really listen. I think it's so important. And so I can't tell you how much I appreciate and love you guys for being open and sharing and just giving a little bit more of what we need to understand. Tyler, what would you like to, as we close, anything you want to share?
No, I just thank you. I thank you both. I thank you, Don, for your heart. I thank you for a willingness to be vulnerable. And Kathy, I thank you for you answering the call.
Thank you. And to that little beautiful girl you have.
Yeah.
So adorable.
She's so beautiful.
I'll give her a cheese ball, and I'll say this. A lot of people. I get crucified a lot because I say MS is the biggest blessing I could have ever received, and I echo the sentiments of Don. And because people say, "Well, how could you say that?" and this did this to me, I said, "Well, I'm only speaking for what it did for me, and for me, it has allowed me to meet some amazing people. It gave me a voice and it gave me a platform."
Amen.
It helped me to discover another level of manhood for me. And it gave me a mission to go with a vision, and it allowed me to serve, right?
Yeah.
So that's the only thing that I was gonna say to help clean it up is
thank you.
This is the space to allow people to understand why I say that. And I know that a lot of people don't like to hear that, but that's okay.
That's okay.
Because not everybody's gonna appreciate you and love you for who you are. So it's all
That's
good.
right. Well, both of you, I just thank you so much for giving your time, and I'm going to pray that this little one feels better because she's just so cute. But I just really appreciate, I love you guys. And I thank you for giving us this opportunity and just being willing to share your stories. And I love you guys. So have a great rest of your day, and we'll chat soon. I have no doubt. I'm going to go ahead
Love you
and
guys. Thank
Love
you,
you.
Don. Thank you, Kat. Thank you.
you.